Hello, everyone. I'm Loanne Lake, and I'm live here in Charlotte, North Carolina at Friendship Missionary Baptist Church for Caring's second annual Maternal Health Conference. I'm honored to be your host for the inaugural episode of Maternal Wellness Matters, a podcast powered by Caring. We are here in recognition of National Maternal Health Month for the month of April. And throughout this conference, we're interviewing presenters, attendees, sponsors, and other speakers. With me now is Simone, who I will have introduce herself to you and the work that she does as a doula. We also have seated with us is her son, Malachi, who will be joining us today for this conversation. And Simone, welcome. If you would share your full name and the company or organization that you represent and the work that you do.
Hi, everyone. My name is Simone Toomer. I am a lactation consultant for Novant Hospital, as well as Lake Norman Breastfeeding Solutions, as well as I have a private practice as a birth and postpartum doula, a childbirth educator, and sleep educator.
So those are a lot of hats that you're wearing.
It is, yeah.
And I'm also inviting you to share today as a parent and what it means to do work in the maternal health space as a mother yourself and as someone who sees the good, the bad, and the ugly of the maternal health crisis.
Yeah.
What has that been like for you?
So with me, my son is 7, but I also have a 12-year-old, right? And I had my daughter in the hospital. I had Malachi at home. And it's always been important for me to involve my kids in my work. My daughter has attended breastfeeding support classes with me on my hip. I think it's really important to be blessed enough to have my children with me. But even if you can't bring your kids to work with you, them knowing your passion, knowing the field you're in, right? And how you serve the community that you're passionate about. And because maternal health is so important to me, they're able to also see and get to know those disparities and how to have a voice, and over time, how to advocate for themselves, their friends, and their loved ones.
Now, what is it that drew you to this type of work?
Yes. Before being a doula, I worked with children and families, regardless, in child protective services. So my hat has always been in regards to like family welfare and well-being. I had my daughter at 12. She's 12 now, so in 2012. And I had a hospital birth. I had a birth that I really wanted, unmedicated, low intervention, no intervention really. But my OBs at the time were very much like, why would you do that? Modern medicine. And then they also did a little fear mongering with, what if you get nervous and your daughter's heart rate starts to fall? Oh my gosh, that might lead to a cesarean. That might lead to her death if her heart rate starts to drop. And so I sat with, what does it look like for someone who's educated, has resources? I had a doula. I was able to take childbirth ed classes and to feel equipped and be able to make informed decisions, but to still get pushback from your healthcare providers and to be like the black sheep in as you make your decisions in birth.
But that's good for you for standing up for yourself and knowing what you wanted. What brought you out to the conference today?
Just being passionate about the work here. I'm from New York. I'm new to Charlotte. I've been here just less than 3 years now, and really to learn what's going on in the field. You know, I've been with Novant for a few months now. I've had some private clients here and there, but it's definitely an eye-opener to see how things are done here, to learn what providers might be supportive of VBACs or home births. Legislation is very different here in the South versus the North. And I think wanting to serve the community, you have to know the community, but you also have to know those who are serving them, right? And as a doula, we are a part of a team. One is not against the other. And so really just knowing the different parts of the team is important to me.
What would you say to other women who are expecting about how they can ensure that they are choosing the best options for their care?
Yeah, I think that's a great question, because even when we talk about advocacy, depending on who you are in your culture, you might not feel like you have a voice, right? Sometimes it's important that you have a sister, an auntie, or someone with you. I always say you can interview your provider, you can hire and fire them. If you just feel not being listened to, unheard, mistreated, disregarded, you can move on to the next for sure. But stay curious about your provider, but also in regards to your own health care.
I love that. You said that you have a daughter who sounds like she's a preteen.
Yes.
How are you equipping her to be the kind of woman who advocates for her health care?
No, that is a beautiful question. I mean, she's seen me from the beginning on my hip, with clients and navigating that, but definitely having those conversations with her, like, how do you feel? Or what are you feeling in your body? Something's hurting you. What do you think this is? How are you eating? Right? Do we need to change something? Looking at it from a holistic lens when we talk about her body and what's going on with her health and wellness. And I've been blessed to have various friends of different backgrounds to kind of ask questions to, but always like, hey, what's going on? Let's talk.
Well, I was going to just bring Malachi back into this conversation. I think it's wonderful that you have your son here.
Yes, yeah.
Because he is absorbing, even if he's not fully understanding everything.
Absolutely.
And I think that will help him as he becomes an adult to be the kind of male that advocates for the people in his life. And so I just want to thank you for your time today, Simone. Are there any parting words you'd like to leave for our listeners?
I always am encouraging everyone to stay curious. Advocacy is really important. And like I said, sometimes we don't feel like we're being heard or listened to. Talk to someone, express yourself, talk up. You have a voice.
Thank you very much.